and I found just right away the benefits of it. We are being sponsored today by Purell Pharma, and they produce Orabloc, and this is the Articaine that I'm currently using, and it's available by your local drug rep that comes to see you, and order Orabloc. So let's talk about the benefits of Orabloc and Articaine. It is a unique amide. Articaine is a unique amide. It has some unique properties from the other amides. It has a THIOPHENE ring, or a sulfur-containing ring, and an ester side chain. So those are the two changes that were made to this specific chemical, with the THIOPHENE ring and the ester side chain. So let's talk about these two benefits, these two changes in the chemical makeup, the chemistry that Articaine has. The THIOPHENE ring gives Articaine a higher lipid solubility. And why is that important? Because it can diffuse through tissues better. It can diffuse and enhance the ability to cross the lipid membranes. And how does this apply to dentistry? My gosh, there are so many reasons why. I practice aesthetic dentistry, and typically when we are doing aesthetics, we need palatal anesthesia as well. And so when I do gain anesthesia, the nice part about Articaine is that it does go through the tissues, hard and soft tissues. It crosses nicely through the bone, and oftentimes gives me enough anesthetic to be able to tap a cord even around the palate and not necessarily need to give palatal injections. So that's been a benefit for me. And as far as the ester side chain, the ester side chain contributes to the rapid breakdown of Articaine once it's injected. And this decreases its toxicity potential. So as we move forward, this, to tell you a little bit of how this side chain allows metabolism to occur, AMIDE local anesthetic agents are generally metabolized by microsomal enzymes in the liver. But Articaine with its ester side chain is hydrolyzed primarily by plasma esterases in addition to the liver. So this plasma hydrolysis is a lot quicker, and it results in a much shorter half-life. And the clinical advantage of the short half-life is that there is less Articaine accumulated and circulating in the blood. So you do the math. The shorter half-life of Articaine can reduce the systemic toxicity that has occurred with other anesthetic agents. And when we're talking about the hygiene department, especially in full mouth disinfection, we need an anesthetic like this, because if we're going to provide full mouth disinfection in one appointment, sometimes the administration of anesthetics could be toxic to gain anesthesia in all four quadrants. I like this Articaine also for my procedures with aesthetics because of its short half-life and ability for me to really work on a full upper arch and not worry about toxicity again.